Hello, students. Good morning, good evening, good afternoon, whenever you're watching this. We are going to continue our conversation today for Module 2. And I wanted to start out with an opening thought. So, today we're going to be talking about health and politics, but I want you to think about technology changes everything, except how people behave when power and profit are on the line. And I want to give you kind of a rewind as towards what we talked about last module, right? So Langdon Weiner argued in his essay, Do Artifacts Have Politics?, that technologies embody political choices. He described Robert Moses's low bridge on Long Island as a prime example, right? Built too low for buses, effectively restricting access to public parks for poor communities who relied on mass transit. Weiner's point? Technologies can enforce social order and exclusion. In today's context, we see similar concerns in AI algorithms and facial recognition software that are disproportionately used on marginalized communities, reinforcing existing inequalities. For example, facial recognition technology has been shown to have much higher error rates when identifying people with darker skin tones, so more melanation. A 2018 MIT Media Lab study found that some commercial gender classification systems had an error rate of 34.7% for darker skinned women compared to less than 1% for lighter skinned men. 34.7 compared to 1%. These biases have led to wrongful arrests, surveillancing, targeting minority groups, etc. Another example, if we want to look at this non-neutrality of technology, is AI's Apple Siri voice recognition software, which historically struggled to understand certain accents, such as Scottish English. In 2020, Apple faced criticism, eventually apologizing after widespread reports showed that Scottish users were being excluded from fully utilizing Siri's capabilities at the time. Critics argued that this reinforced digital inequality by marginalizing those whose voices didn't conform to the system's dominant linguistic training data. And that's important to remember, that it has a dominant linguistic training data. And a third example that we'll start off today is Amazon's AI hiring tool, which was discontinued after it was revealed to be biased against women. The AI downgraded resumes that included words such as women, as in women's chess club captain, or graduates of all women colleges. This highlights how biased input and what Langdon Weiner was talking about can lead to discriminatory outcomes when encoded in technological systems. But that's going to take us to our conversations for this week's readings, where we are discussing this type of problematic structures. As you see on the screen in front of you, right? Too low for buses, and I kind of generate this image, right? But technology changes everything except how people behave when power and profit are on the line. Technologies are never neutral. Power structures shape what technologies do and do not do, and technology's choices embedded in the social values. So now we're going to get a little bit into the conversations that we have as a class, right? So big tech, polarization, and power. So we'll start with this Brookings article, the one that you've been reading, right? It's how tech platforms fuel US political polarization. The big thesis here is this: tech platforms like Facebook, YouTube, and Twitter, or X if we're using Elon Musk's rebranding, don't just reflect political polarization, they intensify it. This happens because their algorithms reward engagement, and nothing engages users more than outrage, fear, and identity-based division. When your business model is built around attention, it turns out that nuances is not profitable. Echo chambers get clicks. Now, sociologically speaking, we can see this through the lens of power and agenda setting theory. These platforms aren't neutral arenas, they're curators, gatekeepers, and sometimes active agents in shaping discourses. But unlike traditional media, there's very little oversight. They scale quickly, profit massively, and pass the buck when it comes to responsibility. So think about actor network theory here. The algorithm is a non-human actor, shaping behaviors, reinforcing ideologies, and determining who sees what and when. This isn't just about personal choice. It's about engineered environments that guide that choice. And let's be real for a second. This affects how we live together. Political polarization isn't just something that exists in Facebook comments, Instagram comments, TikTok comments. It spills into the family dinners, voting behavior, and even trust within inside the institutions. Social media has become the infrastructure of our political lives. The scary part is that it didn't just happen through government mandate. It happened through code, clicks, and corporate indifference. Think about how people are saying, I built my FYP brick by brick. Feels like autonomy, but it obscures the deeper truth. Those bricks were algorithmically selected to reinforce existing preferences, not challenge them. So as Langdon Weiner in 1980 reminds us, technologies don't just carry out politics, they encode them. Tech platforms are now trialing political preference filters, which means we're not just curating content, we're being sorted into ideological silos. Sophia Noble, in 2018, shows how these algorithmic designs quietly reinforce systems of exclusion, producing what Foucault would call the biopolitical governance, which is where power operates through the normalization of behavior, visibility, and identity. The results? Homogeneity masquerading choice, and de facto segregation normalized as customization. But communities aren't built on sameness, they're fractured by it. So as we look at this slide, I did some generating of images here because why not? And we can see this algorithm, ad profit, user engagement. We can see this kind of dynamic of a filter of Instagram, but reinforcing the slide for you, think about adolescents' mental health decline linked to social media rise. Girls are more affected by comparable visibility and aesthetic pressures. Adults show depression symptoms via frequent platform use. Impact and results and constraints of state being watched. The panopticism, the panopticon, the perfect prison is now all around us. Think about social score structures, nosedive, Black Mirror, which we'll cover in this class, quantified social worth on likes and followers. And then we have the gamification of social life, right? Smartwatches are an example. Insurance access and social status hinge on activity scores, turning wellness into mandatory performance metrics. And let me see your steps. You can get lower rates on insurance coverage if you're willing to have an app that turns on when you're in the car. We're gamifying this like we're in Grand Theft Auto, making sure that we don't hit a certain level of police involvement, right? So we see this type of profiteering. So from there, we'll talk a little bit more in Rotman's article, Technology and Inequality article, pulls back the curtain on something we need to keep shouting. Tech doesn't automatically create equality. In fact, it often deepens the divide. You've heard that digital divide, right? While some enjoy smart homes, app-based healthcare, and AI tutors, others are stuck without broadband access or even stable phone connections. This isn't just a digital divide, it's a structural inequality wrapped in innovation, right? What's important here is the ideology of meritocracy. We're told that tech rewards talent and hustle, but myth ignores how access, education, and social capital shape who gets to hustle in the first place. Think of the social construction of technology. Think SCOT. The way a technology develops reflects the priorities of the people building it. If you don't design for the marginalized communities, you often design against them by default. Apps may be quote-unquote free to use, but they come with hidden costs, data extraction, surveillance, exclusion for those who don't fit the quote-unquote imagined user profile. We also see how labor gets reorganized around inequality. Gig platforms promise freedom and flexibility, but often deliver precarity and exploitation. Workers become data points, managed by algorithms and shielded from accountability by the corporations who claim you're your own boss. It's Uber with benefits, Instacart without protection, and Amazon with them 14-second bathroom breaks. The tech might be new, but the power imbalance is ancient. Can you think of any other examples of freedom but rules? Something to maybe ponder for Yellow Dig. One example from my own experience is I worked at Realtor.com, RDC, collectively. I was an account executive, and they built this service, and they had this service where I could give for free called a showcase listing enhancement. We called it slinging SLE, which made sure your realtor branding was on your listings, the ones you represent, the humans and clients you work with. However, after a trial period of around 2 to 3 weeks, if you didn't purchase that same listing from the showcase listing enhancement that we said we knew you had, would then be auctioned to whomever was going to buy the CBC or the lead structure packages. So basically, if you won't pay us to have your name branded, we were going to send it to other realtors, and we would use guilt upon them. The idea that we would guilt trip them by saying our priority is the buyer, not you. We want people to find homes. We want to make sure profit. We want to make sure as much profit as we could, but it sure felt good to say buyer focused. Or did we say profit focused? Right? What happened to Realtor.com, the preferred platform of realtors, the National Association of Realtors' only official website, where our loyalty was to the industry, or is it to the worker? Gone the minutes profits came into play. and economic arbitrage. An example from my case, right? But that brings us to our next conversation, which is a little bit more of a deep dive, since we're looking into this idea of politics and health. So I want to clear up a few things here. So before we get to the next step here, we have that there is the tech and structural inequality. Digital divide mirrors existing class and racial or race dividends, right? Gig economy exploits under a veil of freedom. Tech designed for the dominant class can exclude by default, as we talked about. This is where you see the social construction of technology, that technologies reflect builder priorities. So in your own lived experience, pay attention to these things at ASU. Wilson Hall was just built, and the sociology department, family human development, as well as sales is located there. But why was it not really built for teaching spaces? The company that built it, there's a lot of commercial design. So they made a lot of the desks floating for grad students. They didn't include a lot of windows, just a couple by default, and it's created internal pandemonium, right? So if you've also never noticed, there's no bike securing racks, and there's no water dispensing, places where you can get water bottles and pay for them, so like vending machines. All of the water fountains are not inside the offices, they're in the hallways. And so why didn't they focus on designing with equity involved, right? They had exclusion involved, so not very ADA compliant. What type of clients does the firm serve compared to what they delivered? They don't usually work with a lot of academia, but they did build Armstrong Hall, so what happened? And then we have the myth of meritocracy inside Silicon Valley, which we'll discuss, and as we have with the California ideology. But this is where we're going to get a little weird today with y'all. So I wanted to bring this into this class because I think it's fascinating. But let's talk about Brian Johnson and biohacking from a New York Times post, right, and health.com. And now something more fascinating, but both ridiculous and revealing. Brian Johnson, who's on your screen, the tech millionaire who takes 91 pills a day, wears a baseball cap that shines infrared light into his scalp, and gets regular plasma infusions from his teenage son. He says he's trying to live forever. What he's actually doing is embodying modern techno utopian fantasy that screams, what if I could outsmart death with data and devices? With data and devices. And here's where this becomes sociologically fascinating, not just a weird tangent from Professor McQueen. Biohacking is a type of health-based technological determinism. The idea that we can engineer our way out of a human condition, right? There's this idea that is really important, but let me, one second before I go there. But it's also drenched in privilege. Johnson can afford an anti-aging lab and a team of doctors. Most people are still trying to afford insulin in this country. The very concept of biohacking assumes not only access to technology, but access to time, money, and control over your environment. It's the commodification of wellness on steroids, literally sometimes. It plays into fears of aging, death, and decline while offering a seductive solution. You don't need community or policy or public health if you have a pill and an app. But that's a lie dressed up as progress. And if we pull in Foucault here, we see biopower at work. Johnson isn't just monitoring his body, he's optimizing, surveilling, and disciplining it as a project of self-governance. He becomes both the subject and object of control, an exaggerated version of how all of us are expected to manage our bodies, minds in a neoliberal, health-obsessed culture. And if you think to ancient Greek legends, right, the idea of memento mori is that we have to remember that we die. It's part of our process. And those with means and capital to do so, like Brian Johnson, and these are some of the actual prices listed in a generated slide, but $1,000, $799, $5,600, why can't that money go to those who are suffering? We have to remember that we die to appreciate the beauty of life, but technology allows us to feel deceptive. It allows us that we can outsmart it if we have the means to do so. There are people with much harder living circumstances, but we have folks with this kind of money that is able to take advantage by hyping this out, right? They were even on the Kardashians. This is how big it got, right? And this is where we get to go into some interesting constructions here, right? So let's talk about the digital tech and depression that exists. So this is from Haidt, Allen, and others in your readings, but let's pivot to two major pieces that take on digital technology and mental health. Haidt and Allen's article in Nature and the large-scale survey from Perilous and colleagues published in different psychiatric journals, the Nature article opens by highlighting how the mental health of adolescents, particularly girls, has declined since the early 2010s, which we had on an earlier slide. A shift that strongly coincides with the explosion of smartphone usage and social media. Haidt and Allen emphasize that it's not just any screen time that matters, but highly interactive, socially comparative platforms like Instagram and TikTok. They argue that immersive, performative, and competitive elements of these platforms are reshaping identity development and intensifying psychological vulnerability. More than just correlation, their argument focuses on mechanisms, surveillance of the self, public metrics of social worth, and constant interpersonal visibility. Why? Because girls are more likely to experience social pressure, appearance-based comparison, exclusion on these platforms. It's not just content, it's constant visibility, like likes, DMs, follower counts. These become measures of self-worth. Social life gets gamified further. And I want to add a little bit of an anecdote here. My nephew, who's not as young as I say in my head, told me once when I was asking him about front stage, backstage. I'm like, hey, when I was in school, the bullying happened in person. Do you ever feel like that? He's an interesting kid, a little bit different, but he's super cool and smart. And he goes, no, at school, I don't worry about it. The real bullying now comes when I get home. That's crazy. And I've had students tell me that that's more the new norm, and that's interesting. So, a psych study by Perilous and colleagues reinforces the concerns with large-scale data points. Adults who engage heavily with social media report significantly more symptoms of depression, even when adjusting for baseline mental health and other risk factors. It isn't just about teens, it's structured and widespread. Their findings suggest that platforms themselves may foster or exacerbate depressive symptoms across demographics, not because of what users are doing wrong, but because of how platforms are designed to monetize attention and comparison. And this just isn't about individual behavior. We have to think back again to our readings with Foucault, with biopower at work. Platforms shape how young people discipline themselves, monitor each other, and internalize norm interactions. It's a digital panopticon, the perfect prison, and it comes with filters and backgrounds, right? You can't escape the gaze when the gaze is embedded in your screen. But before we fall into total doom, let's also recognize Nick Allen's counter-argument. Technology isn't inherently harmful. It's about how we design and use it. If leveraged right, digital devices could support mental health through real-time data, mood tracking, or just-in-time interventions. The same phone that triggers anxiety might also send a message that stops a crisis. Again, the politics are in the design. My brother had some heart palpitation issues and was able to know this because of his smartwatch. Whereas it can be monitoring you and become kind of panopticonic towards your ability to see in that lens, it could also be something that saves your life. And on your slide, you've had this up for a while, but we also want to mention this, that if you aren't realizing this, the CEO of GoFundMe has confirmed that 1 out of every 3 GoFundMe campaigns running right now is to pay medical bills, which makes GoFundMe one of the largest insurers in the country. Take a moment to think about that. We really have made it so that healthcare is GoFundMe, sewage, water purification, sanitation law, all these things that we've talked about, public health equal politics and infrastructure. And we need to get real about this. So many young adults that I talk to talk about how they go, should I go to urgent care or the ER? What happened to the primary care physician? Why do we incur massive amount of debt for something that we maybe have the sniffles for? Have we been taught incorrectly? And this becomes important to talk about. Right, I'm going to go back a slide just because I want to address this. So the next article that you would have read is Caldwell Mortality in the Industrial Revolution. So the last Zoom that we're doing is with Caldwell, looking at mortality's decline during and after the Industrial Revolution. Some spoilers ahead, it wasn't medicine alone that saved us. It was sewage systems, public health acts, better microscopes, cleaner milk, and moms boiling everything in sight. The timing of mortality decline came not when industrialization began, but when knowledge about disease transmission, sanitation, and public intervention aligned. Capitalism brought the pipes, but collective action cleaned the water. The takeaway, technology and science work within social systems. It took war, state funding, gendered labor, hello nurses and moms, to make tech life-saving. And this history repeats. Digital interventions today require the same attention to structure, access, and belief. Belief that people matter and death isn't destiny. Biopower also plays in here. As the state increasingly governed not just territory, but life itself, birth rates, health metrics, and population surveillance. Public health wasn't just about preventing disease, it was about shaping citizens. And this conversation is very Foucauldian. and how we look at it. So on your slide, you also see a shift from sovereign power, the ability to decide if someone's going to be executed, to biopower, the way it's kind of slightly regulated. And we'll discuss that next lecture. So let's talk a little bit more about biopower. Foucault's concept of biopower and biopolitics, as described in the readings, helps us see how the state transitioned from sovereign power, the power to kill, to the power to manage life. This shift isn't just about controlling individuals, but regulating population. Who gets vaccinated? Who gets to access to care? And who becomes a statistical risk? In this view, technology isn't separate from politics. It's a mechanism through which life itself is administered. From contact tracing apps to census forms, biopower is about constructing norms of health, productivity, and life expectancy that reinforces who is deemed worthy of care and who isn't, which is problematic. Foucauldian logic draws on a distinction between disciplinary power, which targets individual bodies, and biopower, which governs entire populations. In modern societies, both are present, often through technological infrastructures. Think school vaccination requirements, biometric scanners, or even Fitbits and Apple Watches that track our movement and sleep. These tools encourage self-regulation and standardization of the name of public health or personal wellness. But Foucault pushes us to see how these systems also sort and categorize us, deciding which bodies are normal, which are risky, and which are disposable. Biopower isn't just about life. It's about whose life is protected, promoted, preserved, and whose life becomes a line on a spreadsheet. And for something to kind of bring in a conversation, right? Look at GLP-1s. They are a lifesaver for people right now who deal with obesity and have the food noise and are very affordable if you happen to be someone who has diabetes. If you're somebody who deals with morbid obesity, insurance doesn't cover it, and you can pay between like 700 to 1400 for a pen, where you're injecting it. So now it becomes access to resources, as Foucault's talking about biopower, based upon who has the financial ability to afford us this, right? You have so many of these conversations. If you didn't know, the idea of tampons or the actual pads were something that were being used to stop blood clots. It wasn't until a female doctor thought about how this could be used. It was in the army, and they then applied that to be able to be sold. And then think about pink tax and how we tax it. So much of the tech around us is governed and decided based upon whom it's serving and whom it's not. So power isn't just repressive. It's a product. It's productive and normalized. Biopower, managing populations, as we've said, vaccine, data, and health norms. Think of historic things like redlining, syphilis vaccines in US government and low-income black male populations and the Tuskegee experiment, right? We had the solution to syphilis well before we actually stopped the Tuskegee experiment. Many men of color were actually watched until their mortality to be able to see the impact of syphilis, and they were told bad blood lies. It wasn't until decades later that we apologized for our terrible actions. Who lives and who gets to be decision, right? Disciplinary power, surveillance of individual bodies. This can go into a great conversation of Patricia Hill Collins and the ideal versus perfect image. Whiteness and middle class norms can be detrimental to people of color, especially how it's framed in media and society. Think about the Jezebel example. Controlling images can manifest as targeted advertising that reinforces stereotypes or as bases for online harassment that target individuals based on their race and ethnicity. Just go in the comments, chat, see the people's responses. To this day, 2025 plus, black females, right, black women or black and brown women have a 200+% likelihood of dying during birthing processes because of the lie that was race is a biological fact and pain management. That looks at the biopower structures of health and politics. That's just one example. The panopticism, panopticon, Fitbits, and Apple Watches, we see that who defines health, normal, risky? Seriously, right? FV shred, if you are a fan of that. But then how are we also portraying the image of people who deal with obesity? Body positivity, cheating on traditional diets with the GLP-1 and the loner deviant, right? People viewing that they're cheating instead of someone who's on a health journey. Colleague to individual, when we shift from loner deviance to colleague deviance and binge eating is celebrated, mukbangs online, right? Too far or not far enough. The internet made loner deviant group deviance, right? It made it group deviant. Sometimes think of the negative support websites or Prowana and all these things. It really is about these various decisions and how we look at it. Think about celebrities saying nothing tastes better than skinny. So as we're bringing this to a close, this has been a longer one. We covered everything from Brian Johnson's sci-fi self-care routines to Foucault's idea of the power that isn't just top-down, it lives in your Fitbit. your social media habits, and maybe even your sleep tracker. So if we flip the lens, right, I want to prompt you with an idea. Share a piece of health. Pick one of these and talk about this in Yeldic. Share a piece of health advice or wellness tech you use or you avoid and reflect. Does it help you feel empowered or surveilled? Or discuss a moment where social media clearly shaped how you or someone around you felt, acted, or self-evaluated. This is something to really think about. And a last thought for you, right? As we come to the close of this, every time someone tells you tech is the answer, you have to ask, who designed the question? Who benefits from the answer? And who is left buffering in the sidelines? That's going to bring us to a close of this lecture. I hope this has been helpful. As always, you can always email me, reach out, whatever you would like, and I will see you in the next one, chat.